The number one thing you should be working on, the first thing you should be working on in pregnancy or in postpartum, this is something that I teach all my moms how to do, and I'm talking about how to do a diaphragmatic breath. Okay, diaphragmatic breathing can be so powerful. Oftentimes we just breathe a lot in our chest. Okay, so a lot of us live in this, we are stressed out, anxious. We breathe a lot up here and have a lot of tension in our shoulders and our neck, and we're using a lot of accessory muscles to breathe. But when we learn how to bring the breath into this 360 degree, thinking about the core canister, when we bring the breath down and use the diaphragm more effectively, then the pelvic floor and everything else in the core can respond better. Okay, so this is why it's so crucial. Not only does breathing in this manner will bring your heart rate down, make you feel more, less stressed and more relaxed, but it helps to have the pelvic floor being able to respond like it's supposed to, because things are more stacked. You're able to manage the pressure in the abdomen better when the breath is going in this manner. So I want to show you a few tricks for you to play around and just try it and see how it feels. This is something that you're not going to get in 2 seconds, okay? This is something that you need to practice daily if you can. It might take some time because let's face it, you might have been breathing up here in your chest and using a lot of accessory muscles for years. So it's gonna take some time to undo what you've been doing, okay? So there's a few things that I like to talk about when I teach that diaphragmatic breath, okay? So like I said, the breath needs to go 360 degrees. So I like to think about it as breathing outwards through my ribs, okay? So if you find your ribs on yourself, okay? Place your hands here. Now try not to thrust your ribs up. So you wanna keep your ribs in this downward position. You can do this sitting. Right now I'm just kneeling. You can also do it laying down on the ground, okay? So play around with different positions, but I'm gonna show you in this position. So I'm placing my hands on my ribs and I'm going to take a long inhale, okay? 5 to 8 seconds in, focusing on feeling the air going outwards through my ribs, okay? When I do this, my belly is gonna naturally fill up with air. It's not gonna be, forced out. It's not like belly breathing. It's really the canister is gonna fill, okay? That whole 360 breath, okay? So I'm gonna focus a long inhale through my nose. Okay, so that's the first step, is can you feel the air going outwards through your ribs? Okay, do you feel, when you place your hands, do you feel like your ribs are expanding outwards? Now I want you to keep practicing, and I want you to see, do you feel your belly slightly rising naturally with air? Okay, if you don't, keep practicing, keep thinking about sending the air down, okay? You can also place one hand on your chest, one hand on your belly to see what's moving more, okay? So oftentimes I'll see moms do this, right? So that's chest breathing. I want you to think about bringing it more in your belly, but again, it's not forcing it out. It's really that expansion 360 degrees, okay? So you could go like this. Okay, so that's another trick that you can try with the hands. The other thing is to think about the pelvic floor. Now, this is something that is a little bit more challenging for my moms to do, to think about what's happening to your pelvic floor as you're breathing in. So what should happen as you're breathing in, the diaphragm, this is my diaphragm and pelvic floor at the bottom. As I'm breathing in, the diaphragm lowers and the pelvic floor lowers slightly as well, kind of lengthens and relax, okay? And this is what you should try to feel in your pelvic floor muscles, okay? So as I take my breath in and practice this long inhale, I want to see if I feel anything in my pelvic floor. I want to see if I feel that lengthening, that relaxation in the pelvic floor muscles, okay? So ribs down. Okay, again, this is something that takes a lot of practice. A lot of times moms tell me they don't feel anything in their pelvic floor. And if you don't, it's okay. Just keep practicing. Unfortunately, this is an area of the body that we're just not very connected with. So it takes some time to really kind of feel what's going on down there. Okay, so practice this diaphragmatic breath in every day, 5-10 minutes. You can do it again, kneeling, sitting, laying on your back. Play around with your hand placement. Make sure your ribs are in the downward position. Think about all the components that I've talked about. Expansion outwards to the ribs, belly filling up naturally with air, pelvic floor lengthening, okay? Hope you enjoyed this one. Practice, and if you have any question, make sure to send me a DM. Okay. Bye guys.